to the second day of the International Technical Cooperation Forum. I'm going to mediate the panel, International Technical Cooperation in Human Milk Banks and a coordination between states in favor of global health. And I would like to turn on the cameras, the director of the Brazilian Cooperation Agency, Mr. Rui Pereira, the representative from the Ibero-American General Secretariat, Dr. Socorro, and the Secretariat, Sergipe, Dr. Andrea Alban. And I would like to pass the floor to Dr. Rui Pereira, and also the representative from PAHO in Brazil. Good afternoon, ladies and gentlemen. Good afternoon to all of you who are listening to us now. A special greeting to our moderator, Daniele da Silva.
Saúdo também os integrantes desta mesa.
Okay. And so I would also like to greet the members, the other panelists here from PAHO in Brazil, Ms. Socorro, the Secretary of the Ibero-American General Secretariat, Maria Alban, and I would also like to greet Dr. João Aprígio, because he gave us a very comprehensive view of the international coordination opportunities, the history of the HMBs in Brazil. And I would also like to greet all of the other authorities and participants who are taking part in such an important event. And we are all here connected virtually about international cooperation. And so it's a great joy and satisfaction for me to start talking to you about the international cooperation for the sustainable development of our countries, mainly in favor of global health. So since the beginning of 2020, the world has gone through many, many important social and economic transformations due to a never seen before pandemic, at least not in the recent history. The challenges that we still see in the near future invite us to think about international cooperation to try to face huge catastrophes such as the health emergencies that we're having now regarding the COVID-19 pandemic. And so we would like to strengthen our national healthcare systems. And this unified healthcare system in Brazil is very valuable to ensure to all the healthcare that they need, universal healthcare
nos âmbitos multilateral e bilateral.
And it's very important for us to have that as
os direitos garantidos pela Constituição do Brasil em seu artigo 6º.
And so healthcare
em consonância com esse compromisso
is a right guaranteed by the Brazilian Constitution, okay?
A garantir o acesso universal a serviços de saúde de qualidade à sua população.
And so our population has the right to receive health care. And so the Minister of International Relations, Carlos Alberto França, said that we need to emphasize and take care of our health. It's one of the urgencies, and the international relations policies has to face this, the urgency of the pandemic, the urgency of the economy, and also the urgency of having sustainable development. This agenda was highlighted by Chancellor Franco França in his recent participations at the Senate.
The center of what we announced as health diplomacy, where he showed his personal engagement. That's why also health is a predominant aspect in the Brazilian technical cooperation. The country, given the positive partnership between the Ministry of Foreign Affairs and the Ministry of Health, and why not to say the Ministry of Foreign Affairs and the Fiocruz is one of the main diffusers of technical cooperation in the world. So cooperation in this area represents 14% of our cooperation initiatives and in benefit of other countries in development. 333 cooperation actions carried out in 62 countries of Latin American country, Africa, and Asia. Ladies and gentlemen, do allow me to remember that the Brazilian cooperation agency, which I have the honor to direct, is the one that is responsible for coordinating, negotiating, implementing, and follow up and evaluate at the national level the cooperation for the development for all areas of knowledge, be it received from other countries or international organisms or offered to other countries by Brazil. I like to report that in 2017, ABC was also responsible for the coordination of humanitarian aid of Brazil, donations of medication, food, and other essential items are part of this humanitarian effort of Brazil to help countries that are having environmental disasters, public calamity, armed conflicts, or any other grave emergency, which is even more significant during this persistent pandemic that we are going through. I think Brazil believes that technical cooperation cannot be substituted. It's a significant instrument to promote development with objective of strengthening local capabilities through human resources, training, and experience. So through these efforts, joint efforts, in the ABC, we are willing to implement endogenous local solutions adequate to the challenges of each country. Now, Brazilian technical cooperation has in its criteria of the implementation of projects the 2030 Agenda for Sustainable Development Goals of the UN. And by effect, our annual work for 2021 demands the clear indication of the objectives of development of the 2030 Agenda that orients the implementation of each project within included. I would like to highlight the important role of the cooperating agencies, public and private, all centers of excellence in their respective activities, as is the case of the Oswaldo Cruz Foundation called Fiocruz. I believe that the experiences shared abroad through the projects of international cooperation have contributed to identify problems and to build solutions that are innovative and that are common to Brazil and our partner countries. A beautiful and emblematic example of that is the cooperation developed by Brazil in the human milk banks area. Cooperation, integrated work by Fiocruz, the Ministry of Health of Brazil, and the Cooperation Agency, this low-cost technology with a technical body with a great social impact was already shared with 23 countries of South America, Central, and Europe. It's never enough to emphasize, it's a Brazilian creation. We should be proud of this. In 1943, the first human milk bank was installed in Brazil. And in 98, like our colleague mentioned, João, the Brazilian network of human milk banks by initiative of the Fiocruz and the Ministry of Health, and currently reaches 224 units in all units of the federation. The objective of the network is to protect, support breastfeeding, and collect and distribute human milk too. The action also seeks to reduce mortality. With the data of Fiocruz, 160,000 liters of human milk are distributed every year to low-weight premature babies in all neonatal maternity wards as well. And this Brazilian policy, this Brazilian structure came from 96 onwards. The letter of Brasilia already mentioned this, that defined the commitments for the internalization of HMBs. And like our colleague, we are reaching the dimension of BRICS. We are transforming the network in a direct collaborator of PAHO and the World Health. Soon we will be able to receive more information. And ABC started to coordinate together with Fiocruz a process of coordination, interinstitutional coordination, to take the Brazilian experience to other countries. The expansion of the HMB networks was highlighted in the South-South Brazilian cooperation, and that this space, I like to remember our dear Maria Alban. She immediately gave us succor to put these beyond the borders of Brazil. So it's very just that Maria Andrea is here for our Ibero-American cooperation. She would remember that still in 2007, with the Ibero-American meeting carried out in Chile, approved the creation of the program, Ibero-American HMB program. She can also remember that in April this year, by decision of the 27th summit of state leaders carried out in Andorra, the HMB program was converted into a project beyond the Ibero-American collaboration that will allow renovation of its important contribution to reaching the SDG objectives in the Ibero-American sphere. In the African aspect, that was also mentioned here by Prisho, another reference, the community of Portuguese-speaking languages, of which we are a founding member, and in common with other community actions of greater success, the HMB of the CPLP. This initiative, recognized by the UN as a successful example of South-South cooperation through its use in preventing deaths of newborns, expanded very quickly to all continents, resulting in the creation of what we nowadays call the global network of HMBs. So it's with great joy that I can say that through this global network already benefited 3 million of newborns have been benefited. 30 million women that had the opportunity of being able to keep breastfeeding their kids due to the assistance action carried out by the network. This cooperation constitutes not only a strategic of global reach to reach the SDG objectives, to relate it directly to health, but also a reinforcement, very important, for food security and for the reduction of all kind of malnutrition, which is one of the central of the other UN agencies' objectives, which is the FAO. The global network positively impacts because very early in global health. So all of these are purposes that orient also the PAHO, a regional that is leader in health in the Americas, a privileged partner of the Brazilian government through the Ministry of Health, whose representative in Brazil, Ms. Socorro Gross Galeano, is also here in this event. From the ABC's part, I would like to talk about the renovation of our commitment that we will build innovative solutions for the enormous difficulties that mark this challenging moment and without precedents that we're going through, together with our valuable partners facing this pandemic. And at the same time, we will be implementing the measures necessary to continue to execute the usual cooperation projects that have not stopped developing their activities despite this new challenge and environment. The initiative of the Human Milk Bank networks shows that the South-South cooperation promotes and stimulates the exchange of knowledge, the learning through lessons learned, and the diffusion of best practices, which are added local ingredients specific to each environment where the unit is developed of these HMB networks. The global HMB network, due to its characteristics of highlights and results, is a concrete example of the vigor of the principles that govern Brazilian international cooperation and diplomacy. The solidarity so necessary in this current moment of the pandemic, the horizontality, the mutual benefits, the appropriation of the initiatives by the beneficiaries, the respect for national sovereignty of each country, and the non-interference in internal affairs of countries involved. The global network is therefore a foundation stone of the articulation of states for global health and sustainable development. This event joins us here in what else can we do? In the global network, we understand here at ABC that in fact, we should do more of the same, more of what brought us here 80 years after we started. The pandemic itself puts us challenges that bring us or push us toward innovations because it deals with the new demands that we have to deal with a new view as regards our big projects, our great projects. For example, on the quality of the product, quality of the management of these units, among other challenges that maturity brings us. Thank you very much for your attention and your patience. Thank you and good afternoon. Thank you, Ambassador Rui Guerra. We thank you for your speech. We learned a lot. And I like, in the name of the network, to thank you for all of the support of the ABC from the beginning of our story with the international cooperation. If we are here in an international forum, it's due to the support of the Brazilian ABC, a Brazilian cooperation agency. Thank you for giving some of your time here, teaching so much to so many of us. Thank you very much. In this moment, I'd like to hand over to Socorro Gross, representative.
Boa tarde a todos e todas.
Good afternoon to all. It is an honor to participate in a panel of this nature, international technical cooperation. It's an important theme for the development of our communities, our personnel, and especially our children. I'd like to greet Ambassador Rui Pereira, who made a speech that is very helpful in this moment where we all need solidarity and cooperation that is international and that stimulates the development of our countries, and a cooperation that allows to do development also of human talents. And also I'd like to greet Maria Andia Alban, the General Secretariat of the Ibero-American Corporation, and Daniela Aparecida, and to recognize all of the work that you've developed in Brazilian territory, and especially in this moment, complex moment of the pandemic that has been very, very challenging for us, we from the HMBs. To talk about HMBs is to talk about of the public health interventions that is one of the most cost-effective for the development of our children. For us, it's not only a human milk, it's the most cost-effective, but also a very important element of the act of love that we mothers can do and which society can support. When we're not talking about international cooperation, we can remember, and Ambassador Rui Pereira mentioned, that in the creation of cooperation, the principles of solidarity and mechanisms have developed all of what is the part of cooperation, and one of the modalities, the most important modalities,
y por supuesto en el de nossos povos.
and in the budgets of our people. One of the fundamental aspects of cooperation, and I would like to congratulate the Brazilian state, the Brazilian government, for the work developed not only in the global networks, but the principles of cooperation, the sovereignty of our peoples, which is an important principle for PAHO, because within that cooperation and respecting the sovereignty of others.
And so this power is essential, and it's also essential for creating this capacity building, this cooperation, and then two countries or several countries can exchange information and knowledge. And this is a very important principle for the Brazilian Cooperation Agency, the ABC. And so we are constructing knowledge, and we are also offering capacity building courses at a local level. And so we are working with HMBs that receives cooperation, that receives support, and we could say simple technology, low-level technologies, and they are receiving this. And we should build their capacities, but not only that, we should monitor them, follow them up, so that the HMBs can grow, can increase as networks and become networks. And so Brazil, Fiocruz, and the tireless work that they do, and the tireless work that healthcare professionals do in Brazil, starting from Dr. João Aprígio. And we would like to acknowledge all of his effort and all of his hard work on the work that he does regarding HMBs. In the Americas, practically all the countries, they have been essential, regardless of their economic situation. An HMB, it is a technology that truly allows us to reach a product, to reach interventions in the healthcare sector that you do not have it, you cannot buy it in the market. You need women to be generous, you need them to donate. This is very important when it comes to cooperation and to issues related to cooperation. So you need an intervention in which you also need to have a compromise and a commitment of the people in that country so that the HMBs can truly carry out their subjective intervention to help our babies. So, for that reason, after having worked for about 2 years now, what was proposed so that we could have the first center in the world, the first HMB center in the world, and jointly with Fiocruz, with Brazil's government, with the Secretariat of Foreign Affairs of Itamaraty and of Fiocruz, we created the Collaboration Center in Brazil regarding HMBs. And it became effective this year. It came into effect this year. And having a collaboration center for PAHO, such a collaboration center also allows us to work. When we heard the ambassador, what else can we do? What else can we do? And we, as international organizations such as PAHO, such as the WHO, we can have all of the expertise coming from Brazil, and they have been working for a long time and constructing. Translation apologizes. I can't understand her. They have been working as networks, and so now, and so they can have it, they can transfer technologies, they can transfer knowledge, and they can exchange experiences, they can exchange information.
Bancos de articulación para poder.
And they have been coordinating, working together so that they can make these interventions more public and raise awareness. And a simple intervention from other people's perspective, but it is going to be acknowledged. And I believe that since breastfeeding and the HMBs, they are a treasure, and we can work so that they can become a public asset, a public asset. And when we talk about public assets, we would like these experiences to be well known at an international level. And these experiences should be recognized as public assets that are independent from the development capacity of a certain country. If that country is well developed economically, or if that country is still under development. And I would like to recognize the tireless work, and they have a tireless team, a hardworking team, and Dr. Lige that works with public health, because we need more actions, more people like you, like all of you, even people like Daniele and all of you, so that we can exchange experiences. And during these complex moments, we need to make the HMB networks continue working and helping our society and our population. And once again, we need to foster breastfeeding in complex times, so that we can increase the health indicators and indexes all over the world. So breastfeeding has to be fostered and advertised as being good, even for moments such as this pandemic. And once again, I would like to congratulate you for this meeting, this forum, and we together can do a lot. And we should transfer technologies, we should respect our country's sovereignty, and we should work so that our countries can get to know more and more and become the owners of the technologies, and so that our countries can transfer these technologies to the countrysides of their countries. And so let's build a huge and strong global network. You can always count on PAHO and on the WHO and the work done by Brazil in the international cooperation.
De reconhecimiento,
and all the work done by Brazil should be acknowledged by all of us. Countries in the Americas and the Caribbean is wonderful. Thank you. Bringing to us, okay, the solidarity and our
de bancos de leite humano.
partnership.
Agradeço
And once again,
da OPAS, que esteve conosco em toda a nossa história de cooperação,
of the
nos apoiando para fazer essa articulação entre todos os estados, entre
network.
países que participam da rede
Like to
global.
thank
Muito obrigada pela sua participação.
PAHO for their help for this network. Thank you so much. Okay, thank you so much. At this moment, I would like to pass the floor to Dr. Maria Andrea Albano, representative from the Ibero-American General Secretariat. Good morning, ladies and gentlemen, to all. First of all, I would like to thank to the Oswaldo Cruz Foundation, to the HMB network, to the Brazilian Cooperation Agency. I would also like to thank PAHO and also the WHO for the organization of such an important event. So I would like to be following up this event. The director of the ABC, we have worked closely together regarding international cooperation and American cooperation. And I would like to thank Daniele for passing the floor to me. First of all, I would like to congratulate all of those who are part of the HMB network and organizing an
es el alimento ideal para todo recién nacido.
event such as this HMB network network is very important for all of us, important for our babies, our children, for
y otros
underweight babies,
elementos como los
for
factores de protección
sick babies. And it's
La
very
madre produce
important,
suficiente
human milk is
cantidad de
very
leche para
important to protect them from other issues.
los bancos de leche
And so if the mother also is not
materna.
enough, then human milk banks is important also to help
Neonatal.
mothers that
Los bancos de leche
that
materna y el apoyo social a la
do
lactancia
not
materna
produce enough milk, okay? And so we should always foster and defend breastfeeding, okay?
materna con solo el dispositivo técnico que supone, con el único
Existence
objetivo de preservar
a technical device that should be
su valor.
preserved, and human
Porque se
milk has
dice
increased
madres-
its value as a social tool. And so we are going to be able to help our mothers and babies. And many mothers are going to be helped on how to help their babies and feed their babies. And we should have breastfeeding, encourage these mothers to breastfeed and also to donate human milk. Brazil's example is very, very important for us, and cooperation with them is extremely important. And also the cooperation from Fiocruz and the HMB network. And what has already been mentioned by Ambassador Rui Pereira, the Ibero-American General Secretariat agrees that we should expand the HMB network. So the 22 countries that are part of the Ibero-American Conference, they have signed political commitments, and they are going to fulfill what they have committed to with concrete actions. And they are going to share social cohesion, support, cooperation, and they're gonna cooperate technically and financially. And so the Santiago de Chile in 2007, they approved the Ibero-American program of HMBs. In 2011, in Asunción, that was celebrated, Asunción in Paraguay, they set the 19th of May as the International HMB Day. And so in 2019, the program started being a written project, and this project has it as its strategic goal to support the implementation of HMBs in all of the Ibero-American countries, and also to exchange knowledge and information and experiences between the member countries, trying to reduce infant mortality. And this written project wants to reinforce the construction of the Ibero-American HMB network and to implement HMB to offer capacity building to all of the professionals, to integrate all of the HMBs in the region, in the Ibero-American region. The countries that are part of these projects are, among others, Argentina, Bolivia, Brazil, Colombia, Costa Rica, Spain, Paraguay, Peru, Uruguay, and Venezuela. This is horizontal work and a collaborative work. And so these Ibero-American countries, they share strengths and technologies, and they are also implementing innovations regarding the HMBs. And so, having said this, they are also trying to meet the SDGs and to reduce the causes of infant mortality. So we can express that the HMBs, they are strategic so that we can meet the SDGs and reduce child mortality. And so this is one of the most important programs of the Ibero-American cooperation. And you can count on us. and donating milk is an act of love. Thank you so much.
Mas
And
eu
so
gostaria de
now
agradecer em nome da rede a
we
participação do senhor.
thank, on behalf of the network, the participation of Ambassador Rui
Celebramos o Dia
Guerra, Dr. Socorro Gross, and Dr. Andrea. And to say, we would like to thank all of the participants of the network, and we would like to thank all of these organizations that were present here today. Thank you so much for your participation and to all of the panelists. I'm going to pass the floor to Dr. João Aprígio because he has raised his hand. Dr. João, I apologize for breaking the protocol, okay? And I could not wrap up this session without sharing my sincere thanks, okay? On behalf of the HMB network and also on behalf of the ABC and also on behalf of Fiocruz. And I would like to share that he has been working hard, tirelessly trying to increase the cooperation and help in the technical issues, okay? I would like to say that our responsibility has increased, Dr. Socorro, and our new job is to try to help you, okay? And you can count on us, okay? So that we can correspond to your expectations, okay? And we know we can count on PAHO, on the WHO. Thank you so much, and thank you for your kind words, okay? I didn't deserve so much. Thank you so much, Ambassador Rui Pereira. Thank you, Dr. Alba, for being here with us, okay? Okay, and thank you for the Ibero-American Secretariat, and thank you to PAHO.